Welcome back to Somatics meets Pelvic Health. For this week, we are going to be focusing in on breathing and pelvic floor relaxation. When we talk about birth preparation, what we're really talking about with respect to the pelvic floor is learning to let go, learning to open, learning to surrender to the birthing process. And it can be really helpful to connect to our pelvic floor, to know how it moves, how it responds to the breath, how we have some conscious control over what our muscles are doing, and then learning to let go. Learning to let go despite other sensations being present. And having a trust within our bodies, a deeper trust that our bodies are going to respond the way they need to respond. So we're going to be in a seated position today. So if you have a cushion or a pillow, I encourage you to bring something that makes this process comfortable for you. Maybe a yoga mat or a carpeted area. And I want you to get into a comfortable seated position. Doesn't have to be cross-legged like this if this is not comfortable. It could be legs out, straight ahead. It could be legs out front. The most important piece here is that it's comfortable for you. What feels good for you? And so we're going to be using our breath and kind of to give you a couple of visuals to use as you try to connect deeper with your pelvic floor, which is down here at the base of our pelvis, is thinking about as if there was a balloon inside your pelvis, sitting right there. And imagining as you take that inhale, that balloon is expanding and opening. As you exhale, that balloon releases the air and shrinks down. And so I want you to, as we go through the breath, seeing if you can notice any sensation of expansion and constriction or release of pressure down around your pelvic floor. It's the idea of when we first sit down on the toilet, and if you haven't brought your awareness to this, then I encourage you to do so, sitting down on the toilet and noticing the moment just before urination or just before a bowel movement. Your pelvic floor has to let go in order for the process of elimination to happen. And so similarly, when we're preparing for birth, we're opening for the baby to birth through. And so that's why this technique is very important. So I want you to get into a comfortable position, putting your hands where they feel most comfortable for you. If that means a hand down here to help you make that deeper connection. Eyes can be open or eyes can be closed, whatever feels good for you. And we're going to start with just getting our breath situated, taking an inhale through the nose and exhale through the mouth. And I just want you to breathe in and out without trying to make anything happen. Just breathing in and starting to bring your attention toward your pelvic floor. And exhale. Just noticing if you notice any sense of expansion. Maybe you're starting to feel it in your tummy. And exhale. Just noticing if you can get a sense of that balloon expanding. And exhale. And if you're not really feeling anything in the pelvic floor, that is okay. Maybe bringing your attention to the lower back and the lower abdomen and seeing if you can bring your breath to expand in your lower tummy and lower back. And exhale. Inhale, expand around your lower back. Exhale. Maybe now bringing the attention toward the buttocks. And seeing if you notice any expansion in the back part of your pelvic floor. We are not pushing with our breath as if we're having a bowel movement. So pelvic floor relaxation in this case is not about pushing out. It's more of letting go of the tension around the pelvic floor while you're taking a breath in. So breathing in and thinking expanding around the pelvic floor. Exhale. And you can even think about your sits bones, the bones that you're sitting on, and you can even take your hands and place them on either side of your buttocks. Just feel those bones. If you wiggle your butt, feeling the bones that you're sitting on, and then taking your hands away, but keeping your mind focused on those two bones. As you inhale, notice or think about expanding the space between those two bones. And then exhaling, noticing how the two bones sort of float what seems like closer together. Inhale and expand. Exhale. And release. Just take a couple breaths and just notice what you feel inside the body. Now we're just going to kind of bring our attention to our whole body. Just noticing if we need to shift or change or move position. Again, we're looking for comfort and feeling good and feeling okay. And then you can open your eyes if they weren't already open. And just noticing how that experience was. Was it relaxing? Was it connected? Was it challenging or even frustrating? Just noticing what the feeling is. How was that experience for you? Without judgment. This technique is not something that we consciously think about or ever really practice, right? We talk all about, you hear everything about Kegels and squeezing and tightening. But when do we really take time to relax and connect to our pelvic floor? So if you weren't noticing much, that's okay. It's a practice. It's a practice of connecting our mind to our body, and especially the pelvic floor, because you can't see it. You have to feel it. There is no easy way to connect. We have to be present and feel it. And so we're going to continue on this week with different ways to connect to the pelvic floor and pelvic relaxation. So if in this position and you're practicing and again you don't notice much, no judgments. No judgments. Just trying to connect. And then I'll be giving you some new positions to try to connect. Maybe this position doesn't work for you. So we're going to give you some more options. So I look forward to connecting with you again on the next video. Bye for now.